Sustainable Development Goals.
For our SDGs, we focus on Goal 3, Good Health and Well-being, and Goal 11, Sustainable Cities and Communities.
SDG 3 is about good health and well-being. SDG 3 helps the poor people that are in poverty, to get the health back if their health was bad.
We think this is important because if any people of the family member gets sick, the family will get in more poverty and the poverty cycle will happen again.
To make this goal successful, the UNDP make a lot of targets and make it measurable so that they will have aim of what they can do to achieve this goal specifically until when. There are targets, for example, by 2030 prevent or end the deaths of children losing their life under at the age of 5. By 2030 end the epidemics of AIDS, tuberculosis, malaria and all the diseases that cause many deaths. Half the number of deaths or injuries by a traffic accident. Support the researchers of making all the vaccines and medicine for the communicable and non-communicable disease that primarily affect the country that is developing. Increase the health financing and more people that can help people in poverty, especially in NDC.
There has been improvement over the years, and child mortality rate has gone down over the years. Ensuring health for all people is important because then we can build prosperous societies. Being emotionally and physically healthy is very important. It is important because if you are not mentally or emotionally healthy, you might make irrational decisions that you may regret later. These kinds of decisions could affect yourself and others, and you may find yourself in a sticky situation if you make a bad decision. It is important to be physically healthy because if you aren't, then other people may catch what you have, and then more people could get sick. And if you are exhausted, then you could die of fatigue.
The first graph tells us about life expectancy of some countries. Throughout the data, the life expectancy is increasing every year. This means it will be more higher soon. The second graph tells us about public health insurance coverage. Public health insurance coverage means the insurance that people has or takes. As the time passed, the percentage of getting the insurance increased.
For SDG 3, Ethiopia is one of the countries that is most affected and need help by the Sustainable Development Goals.
Ethiopia is one of the poorest countries in the world. In 1977, Ethiopia introduced a 20-year program which would help develop the health sector. They created this program a little bit before a war started. The war resulted in more illnesses, and there was less people around to help those who were ill. But this was not the thing that could cause illnesses. There were also harmful practices such as female genital mutilation. Things like this could have been avoided, but they did it anyway, causing way more harm than needed. In 2004 to 2005, they trained many people, and they called them HEW, Health Extension Workers, which would help them meet goals 4, 5, and 6 from the MDGs. These goals would reduce child mortality, improve maternal health, and combat HIV and AIDS, malaria, and other diseases.
Now we will tell you about what SDG 11 is.
SDG 11 is about sustainable cities and communities. SDG 11 helps people to get or have a shelter that they can stay safely.
We think this is important because if poor people in poverty, does not have any shelter, their life expectancy will be low, which will be hard to earn money, and the poverty cycle of shelter will continue.
The main point of SDG 11 is providing access of safe, be more inclusive inside the society, and more accessible to green and public places. There are more than these, but these are the things we think it is the main targets of SDG 11.
SDG 11 is very important because by not having a proper home can maybe affect you in other way like health or sanitation, because having a proper shelter may keep you cleaner and protect you from pollution. Many people in India still live in a housing that's below average a normal house. This happens because the price of the housing has made a plan for 5 years, which is from 2012 to 2017, about making more house storage in India for the homeless people, and it actually reduced to 18.57 million. However, the data is still questionable, and the government department is still having an argument about not getting a proper and exact data. This goal couldn't be maintained due to the land price, financial and regulatory concerns. Therefore, this SDG has to be fully completed with exact data, and the aim should probably be bigger so maybe more people can be helped with getting proper and nice houses.
The first graph is about number of homeless people per 100,000 population in 2013. From the first graph, we can see that there are a lot of homeless people in France and there are not that many people in Portugal. The second graph is about number of unsheltered homeless people per 100,000 population in England. From this graph, we can see that the homeless people are increasing every year.
More than half of the world population lives in an urban area. It is predicted that two-thirds of the world's population, which is around 6.5 billion people, will live in urban area by year 2050. But the problem is there will be a consequences that there will be not enough houses provided for all people, especially with people who lives with very low income. Extreme poverty is mostly concentrated in urban area. This is because the government is struggling with to accommodate all the rising population in the urban area. In this case, LEDC has more advantage than MEDC because urban area in LEDC has more land for people to live. On the other hand, MEDC might not have any more places for other people to live.
India is one of the countries that has the most problem with housing poverty, especially in Kaknam, Andhra Pradesh state, and southeastern India. The Indian government were very aware that India was in a huge problem with poverty from the 1970s and already took an action. After 20 years, the Indian government had made a success of decreasing the whole poverty from 65% to 20%. Habitat for Humanity is an organization which is helping people to have a decent shelters. This team had went across 20 states and had helped hundreds of thousands of people. However, India is still remaining housing poverty issue due to increase of population and income inequalities.
We think the UN can accomplish this goal. We think that they can accomplish this goal because we can continue to help those people who need help by SDGs. Also, the UN can get some support and build more shelters that will make them more safe and affordable.
If possible, UN can make the transportation price more cheaper. They can make things safer for people who are disabled or old. We can be more inclusive to them and try to give them more chances to get job even if it will be hard.